Nicole, and you're going to notice a change in your vision right after surgery.
Yeah, although things will be kind of foggy and smoky until you wake up from your nap today, and then it will be a lot clearer and probably even more so tomorrow.
Okay.
So right after you're done, I'm going to give you another 5 milligrams of Valium,
Okay.
and then we want you to go straight home and try to sleep for as long as you can.
Okay.
2 or 3, even 4 hours would be great, because this is going to allow for the most rapid healing to occur. If you're unable to sleep, we'd still like you to lie there with your eyes closed for a couple of hours. But if you're unable to sleep because you're in any kind of discomfort, it is okay to take a Tylenol or an Aleve or an Advil or an ibuprofen, whatever you normally take, even though you've taken a second dose. But if you try to stay awake and you try to keep your eyes open, once the numbing drugs wear off, you may be in some slight discomfort, meaning light sensitivity, slight stinging and burning, and tearing are all very normal for the first few hours after surgery. But if you're able to get home, get to sleep, you just sleep through any of those post-operative discomforts. Now, if you do tear up, which is normal, allow the teardrop to fall down your cheek and then wipe it away. But try to avoid wiping your eyes like this. In fact, avoid wiping them or rubbing them, touching them, or squeezing really hard for about a week. Okay? We also would like you to wear these sleeping goggles. Just for a week of just when you sleep. And this is just so you don't inadvertently rub your eyes or poke your eyes while you're sleeping. So they're not meant to fit real tight and secure like swim goggles would be. We don't really need pressure on your eyelids whatsoever. They're just meant to fit lightly over your face to shield your eyes so you don't accidentally rub them or poke them in your sleep. Okay, so just for a week, just when you sleep. We also would like you to try to keep water away from your eyes for a week. So it's still okay to shower, you can still shampoo, just face the shower head towards your back and allow all the soap suds and water to go down your back. As far as washing your face, we suggest that you use a washcloth or wipes, but try to avoid splashing water into your face like that. It's just because water can carry bacteria, and we just want to keep that away from your eyes while you're trying to heal. Okay. We would like you to wear UV protected swimwear when outside in the sun. And if you play in sports, we want you to wear sports goggles for a couple months. This is just so a ball or an elbow doesn't come and hit you in your eye when you're trying to play. Okay? We would like you to avoid wearing eye makeup for at least 3 days, although you don't need any, so you don't really have to. But if you must, you can after 3 days, but just be careful when applying it or taking it off, not to rub on your eyelids real hard. Okay? So we'd like you to start using your eye drops once you wake up from your nap today. So you have your Lotomax, your Best Advance, and your artificial tears, I see. Perfect.
Those are fine, right?
Those are fine. Yeah. So with the Lotomax and Best Advance, I want you to shake up the bottle a little bit to emulsify the drop before applying it, just to get an even distribution of medication each and every time you apply. As far as the artificial tears, those are every 4 hours or as necessary for dry or itchy eyes. You might even have to use them a little more often. But let's say it's only been an hour or so since you put your drops in, but maybe you've been outside in some strong wind, or you get a computer and your eyes feel a little dry and you feel like rubbing them, just put more of those artificial tears in. That's what's going to help you. Use up all the drops till they're gone. The medications will probably be gone within the week, but continue using your artificial tears as long as you feel necessary. We suggest for at least a month. Okay. So redness in your eyes is normal after surgery. It varies from patient to patient. But if it does occur, I don't want you to think that anything is wrong, because what can sometimes happen, and it's actually quite common, is in the first part of surgery where the doctor is going to place a small plastic ring in your eye. So he goes to take that ring off. There's a suction that's been created between the two. So it can sometimes go and leave a little mark, or an eye hickey, the doctor teases and calls them. But that's just what they are. They don't affect your vision. They don't hurt. They just don't look so good for a few days, but they do go away. So if it does occur, don't worry, those will go away. So in a few minutes, the technicians are going to come and get you, take you into the surgery room, lie you on the table, and they're going to place some numbing drops in your eyes. Now the numbing drops work instantly, so there won't be any downtime. And then the bed's going to automatically move over to the first laser, and that's the FS200. That's the laser the doctor's going to use to create the corneal flap. So this is where he's going to take and place the small plastic ring in your one eye first. Now this ring connects to the laser and it prevents your eye from moving around. And I have to say, out of the whole short procedure, this part is probably the most uncomfortable part. Not so much painful, but it's just very strange and unnatural to have a ring in your eye.
Yeah.
And then he does have to apply a little bit of pressure in order to create that. I just want to let you know what to expect so that you're prepared.
Okay.
So once he's done with the one eye, he'll take this ring off, he'll cover that eye, and then he'll take another ring, place it in your other eye, and do the same thing. Once he's done with that, he'll take that ring off, and then the lead is going to automatically move over to the second laser, and that's the EX500. That's the laser the doctor's going to use to correct your vision. So while under that laser, you will no longer have a ring in your eye, but there will be something holding your eye open. But you're not going to feel the need to blink because he's going to use lots of drops and gels throughout the whole thing. In fact, he'll be talking to you and communicating with you the whole time. So the first thing that's going to happen is an illumination ring is going to come down and come right in front of your face. And what I mean by illumination ring, it's just a ring of bright white stadium-like lights. And beyond those are a few other colored lights. But the most important light is the green light. And the doctor is going to ask you to find and focus on the green light. So while you're doing that, you're going to see a few instruments passing over your eye, but you're not going to feel anything. And then you're going to hear a couple buzzing sounds coming from the laser. First buzzing sound is just the laser charging up, and the second buzzing sound is the laser discharging and actually correcting your vision. Once he's done with that, again, you will see a few instruments passing over your eye, but you still won't feel anything. Then he'll put a whole bunch of drops and gels in that eye, cover that eye, and repeat everything on the second eye. Once he's done with that, he will sit you up, ask you if you can read the clock on the wall, and you'll say, "Oh my gosh, I can." But things will be a little foggy and smoky until you wake up from your nap today, and then it will be a lot clearer, probably more so tomorrow.
Okay.
Okay? The last thing I need to let you know is you might smell a little something funny while under the second laser. Have you been told about this?
Yeah.
All
Smells
right.
like burning hair.
Yes, but please don't think anything is burning, because I promise nothing is. It's a cool beam laser. There's no heat involved, but it does omit that sense. So I just want to again let you know what to expect, but please don't think the worst, okay?
Okay.
Okay, now do you have any questions or concerns?
No, just I need to use the restroom.
Okay, I can take you to the restroom right now, in one in the office, and then I'll bring you all back here, okay? And I'll give Carol in just a little bit, okay?
There you go. Alright, Isaac, how you doing?
Alright.
Good. She got the whole thing on film for you so you can
Say hi.
watch over him when you wake up from your nap.